Hey guys, welcome to the last week. We're going to talk about chapter 11, which is your chronic disease chapter. This chapter is filled with so much information that it's hard to even comprehend sometimes, and this is the gory details of health that people just don't want to talk about. They're the non-glorified pieces of health that we try to avoid at all costs. So if you have any questions, please reach out, or if you have any concerns, or just, again, thoughts, perceptions, please let me know. So I want to start off by saying that cancer is not the number one killer in the United States and is not the number one leading cause of death. A lot of people feel like because they encounter cancer so much and cancer is so volatile and just gruesome that it is the number one killer, which in Jackson County it is, but across the world it is not. So heart disease is the number one killer in the United States, and I just want to make sure that we are fully and plainly aware of that. Across the nation, cardiovascular disease is the number one killer across the board. Some counties differ, like Jackson County, again, cancer is the leading cause of death in Jackson County, but for a vast majority of counties, you will find that heart disease is the leading cause of death. So, segueing into heart disease, CVD, which is in your PowerPoint, is called cardiovascular disease. And cardiovascular disease is anything that affects the heart in the capacity of heart vessels, veins, valves, anything that affects the heart is considered to be heart disease. So there are multiple different capacities to heart disease. So you have peripheral artery disease, arteriosclerosis, arteriosclerosis, high blood pressure, heart failure. All of those things are considered to be heart disease. Stroke is actually considered to be heart disease. Stroke is the number 3 leading cause of death, or the 3rd leading cause of death in the United States. So again, just to reclassify, stroke is considered to be heart disease. So that's something people misconceive and don't fully grasp, and I want to make sure that we understand that in this course. Moving forward, how do we assess, how do we measure cardiovascular disease? So you get tested or diagnosed with cardiovascular disease through multiple different tests, and those tests are EKG, EEG, MRI, and blood tests are usually the main methods to finding some sort of cardiovascular disease. So when they ask for an EKG, they're trying to assess what type of heart issue you have. An EEG is a little bit more it's not used as much as an EKG. MRI is also another method, obviously. So you have those 4 methods that are the main usage or the main finders of cardiovascular disease. So I want to clarify there are 2 different types of artery disease to speak. So like I mentioned just a minute ago, you have atherosclerosis, which is a mouthful, I know. And that is the buildup of fat or cholesterol tissue within your arteries. So basically what that means is it's just the blockage of an artery. So you would need a stent or something to kind of keep that artery open. That's about the only way that that's going to happen. And the way that that buildup is it's not just a buildup from eating one Big Mac. It's a buildup from your diet and your life choices over a span of time, which is why heart attacks usually happen later in life and not earlier in life. So the buildup of fats can occur from your diet, lack of exercise, alcohol, tobacco, drug use. All of those things contribute to atherosclerosis. Now, your second type of artery disease is arteriosclerosis, which is the hardening of a vessel or artery. So the elasticity of that artery shortens, so the blood does not pump through your heart as quickly. So right now, your arteries, your vessels are elastic. They can expand, contract with the blood flow that moves through them. Now imagine that artery or vessel tightening up and not being able to expand and contract as much. So naturally, you're not going to get as much blood flow through those arteries and those vessels. So it's going to create issues. It's going to probably be painful in the long run and could cause heart failure or heart attack. So those are your 2 types of artery disease. You also have peripheral artery disease, which is in the limbs. So you have a blood clot in the limbs, essentially. You need to get that fixed ASAP or you could potentially lose a limb. So those are your main CBD. I'm hitting on the basic points. Your PowerPoint covers it pretty in depth. The things to avoid with CBD, or to not get CBD, would be nutrition, exercise, tobacco use, alcohol use, and stress management. So making sure that you have a positive, healthy lifestyle all around is going to help you avoid contracting CBD unless you're pre-genetically disposed to it. In that case, you can reduce your odds of getting it or reduce your odds of experiencing symptoms quicker. So a lot of times I will hear, well, I'm going to get it regardless of what do I do, so why should I care? That, my friends, is going to expose you to probably quicker results of that disease or illness and probably more dramatic symptoms as you go through life. So you can either have a healthier life as long as you can, or you can have that short time frame of doing whatever you want and then experiencing the repercussions for the rest of your life. So it's just a matter of personal choice in the way that you want to live your life. No judgment. But cardiovascular disease, you can prevent those things or reduce your risk by eating right, getting regular, consistent exercise, and reducing your stress as much as you can in positive outlets, not smoking or stop smoking before you're 30, and then not consuming regular alcohol. So those are your typical prevention strategies for cardiovascular disease. The next thing I want to talk about is cancer. So we've already kind of mentioned cancer not being the leading cause of death, but it is a significant factor in death. We see cancer all throughout our lifespan. If you've not encountered cancer, I would be very impressed. I, for one, have encountered cancer way too much in my lifetime, and don't wish that experience on anyone. I personally have not had cancer, knock on wood, but I have had to take care of multiple people with cancer, and that experience is excruciating. So I don't wish that on anybody. You have your different types of cancer listed in your PowerPoint. We're all probably pretty familiar with those. You have 2 questions in your PowerPoint that are not answered that I want to answer in this video right now. So what is the most frequently diagnosed cancer? According to the American Cancer Society, breast cancer is the #1 leading diagnosis of cancer. Your second would probably be skin cancer. I don't have that on record on American Cancer Society, but that would be my guess. Your second question in your PowerPoint was, what cancer is the leading cause of death among cancers? So the most lethal type of cancer that there usually is that's associated with death rate, and that cancer is lung cancer. So lung cancer is the #1 killer, quote unquote, among cancer. So it kills more people than breast cancer, prostate cancer, and there's one more cancer in there combined. So the death rate of lung cancer is significant and should not be taken lightly. So the reason that lung cancer is so predominantly impactful is because think about where your lungs are located. Your lungs are located in the central cavity of your body that is surrounded by everything else within your body, and your lungs also provide blood and oxygen throughout your entire body. So if the cancer cells get into your lungs and metastasize, then that tumor marker or those tumors can spread to different areas through blood. And there's a lot of different things going on in those cavities. There's a lot of different space shared. So it's pretty central for that to spread elsewhere. And obviously, the big part of lungs is you cannot remove your lungs. You can remove a piece of your lung, but you cannot remove entire lungs. So keep that in mind. Of a lot of different things you can kind of remove, but the lungs are one of the few things that you really just can't remove, much like the brain. So that's another big piece of that. Moving forward, your recommended blood pressure intake, or recommended blood pressure, I don't know why I'm saying intake, would be 120/80. There's some, if you Google, it'll say 115/70. I would really prefer, if you are asked, for you to say 120/80. If you don't say 120/80, I will count it wrong. The only other thing that I really want you to be knowledgeable about is how viruses spread on your college campus. So, viruses spread through airborne droplets, which gets into our viral system. But remember that we have protective lenses, so to speak, within our bodies. So, our eyelids, our eyelashes, our nose hairs, genitalia, our skin, those are all things that protect us from viruses. But the number one leading cause of illness spreading on college campuses is hand washing. So people do not wash their hands. They go to the bathroom, come back really quick to class, open, close the door, spread that germ because everybody's going to be touching that door. So, hand washing. Make sure you're washing your hands. And as always, I've enjoyed this semester with you guys. If you have any questions this week, I know it's a rush week. Please, please, please reach out to me.